Greetings. This is one of our series of updates on the COVID-19 situation. The fact that we call it COVID-19 and it's 2 years later tells you that we've been in it for the long haul, and that's something that's important. There are some important updates, and I'm kind of holding these when there are important things to discuss. My major message today is don't panic. We can do this. We've been here before, and we can do it again. And the world situation is dominated by what we call these variants or the mutations of COVID. And that in some way makes them sound mysterious. All viruses change and mutate. It's what they do. Because what they do in life is just replicate their DNA or RNA. And therefore, mistakes are made, and most of those are fatal to the virus, which is what we hope will happen to a rapidly replicating virus. But some of them provide an advantage. Okay, these mutations were originally named by the country that they were first discovered in, but we discovered that becomes politicized and weaponized by some people. So we use Greek letters, and delta is the variation of this period. And it's a variation that has changed the receptor. In other words, the virus is spread. You may inhale it. Usually that's what happens. And it finds a receptor, which is particularly good at adhering to respiratory, but it can in other parts of the body. This variant has a little bit better ability to adhere. And therefore, people get a larger load of it, and it spreads easier. Unfortunately, as easy as chickenpox. Now, we talked earlier in earlier ones about which viruses were intensely easy to spread, like mumps, measles, and chickenpox, and which, like this, were a little harder, and which, like hepatitis, harder again, etc. Well, this has become easier to spread. So what's happening? Well, the world situation is worrisome because so little of the world is vaccinated. And therefore, when it does hotspot, as these do in those areas, there's great death and suffering. And it's of all age groups. But it's always worse in the elderly. And the elderly is being defined differently. And we'll talk a little bit about why. In the US, the situation is totally dominated by the areas that are not vaccinated. This is a country that is very highly vaccinated compared to the world, because some even very populated, developed Western countries are not very vaccinated at all. And so in the areas of the US which have, for their own reasons, which are twofold: one, personal liberty, they don't want anybody to tell them what to do, or two, um, politicalization of it, or they really don't believe the data. People haven't been vaccinated. This is a disease of the unvaccinated. And hotspots like Florida, Texas, Arkansas have been very dominant. We are, however, seeing a gradual increase, and that tells us the variant is here, and we have to know it and deal with it. Okay. The most important thing to understand is this Delta variant has not defeated the major vaccines, the RNA vaccines made by Pfizer and Moderna in this country. It is possible for someone who is vaccinated to get the Delta variant, but their hospitalization and death rate is very low. There's two reasons for that. One, the Delta provides a larger inoculation, more virus goes into people. So if you're unvaccinated, you're going to get it. And if you're elderly, you're going to be very sick. But fortunately, we vaccinated a vast majority of the elderly. We're not having people dying in their nursing homes anymore. So most of the people who are getting it, and you're exposed to it, are either stopping it with their mask and separation or getting it but not being very sick because they didn't get a huge viral load, they were wearing their mask, and they were vaccinated. If they aren't vaccinated, and a lot of people get this Many of them aren't very sick, but some are, maybe 4%, and they're getting hospitalized. We're better at treating it, and they're generally younger people, so it isn't dying in as great a rate here as it is in other countries, but that's just good fortune more than anything else. So the dominant point is the vaccines still work. We need to talk about booster shots, etc. But if you can decrease the viral load, wear your mask, stay 3 feet apart, and be vaccinated, your chances of getting sick have gone from 1% to 4%. Now, never before have we had a vaccine this effective. We're used to vaccines which are 60% effective. This one was 99 to the original strain. And if you look across the country, there are exceptions. One is in Provincetown, Massachusetts, where more, but on average, 96% of the vaccinated people are protected. That's 30 points better than the average vaccine. So even the Delta variant is not defeating this vaccination as much as any other virus defeats the old-fashioned vaccinations that we've been getting all of our life. Okay. The question now is, if it spreads as easy as chickenpox, and we do know that if you get a large load of it, you've been really exposed in the mash pit which was outside the Bucks basketball arena, that there's over 500 people that are now infected, but they got infected, but they're vaccinated. They're not that sick. If they weren't, then they're very susceptible. And so vaccinations still work. Decreasing the viral load, because I don't think you're going to escape being exposed to this unless you really seal yourself in. But if you vaccinate and take common sense precautions, I think you'll do well. It is in some parts of the country, California, etc., where the hospitalizations are increasing, Florida and or Louisiana, overwhelming the hospital that takes care of COVID. 99% of the people in the hospital are the unvaccinated. So that tells you all you need to know. And don't panic. With the vaccination, you're going to do well. I am concerned that even here in Wisconsin, which is highly vaccinated, but pockets are not, we're beginning to see hospitalization cases go up. Not deaths, but that may follow. Okay, so what am I saying? Absolutely yes to masking indoors. I'm doing it. I recommend you do it. Because you could get it even if you're vaccinated. You probably won't get very sick if you decrease the load you get. And if you get it, even asymptomatically, you may spread it to somebody you care about. And so that's important. Outdoors, the data is pretty good that we're okay. Just don't mash together in the mash pit outside the Bucks arena. And that makes sense. But all those people were unmasked, and 30% of them, on average, weren't vaccinated, just if you look at our data. The biggest concern I have is children. I predicted that in my most optimistic numbers that we will not have a vaccine for the children before October. I still hope for that. I cannot say that it's a given, though. And we want to open the schools. And I believe that's important. I even believe it's a good thing because of the difficulties of kids' education, socialization, etc. And we know that most children don't get sick at all if they're exposed to this, but some do. So masking and three feet separation in the schools is what people are going with. And I think that's the right thing to do. I'd be less than honest if I didn't tell you I was worried about it. And I very much hope that we'll be able to vaccinate children soon in the fall. I is starting without studies in one other country. And remember, the difference between the ideal situation would be we everybody wakes up tomorrow and says, good Lord, look at this data. 99% of the people in hospital are unvaccinated. I'm getting vaccinated. We get them done in a month, which is possible, probably 2 months. And then we get the rest of the world done in a year, and we stop talking about variants and mutants. That's the ideal world. That's not the real world. Because the US is slow to accept vaccinations to the rate we need for it not to be present here. This Delta variant is perfectly happy attacking the 30% or 50% in some areas that are not vaccinated and filling the hospitals. The situation in the rest of the world is very, very sobering. We have countries with less than 3% vaccinated. We are begging, paying people, doing lotteries, giving scholarships to college to try to get them to get their shots here. In Zimbabwe, the line for the shots before they run out is 3.1 miles long. That's a 3-mile line people are standing in a city without water to try to get their shots. So we have to be aware that we're special. Now, the real world is that not everybody's been vaccinated. So what's going to happen? Well, we do not need chaos. We need to be sensible. Protect yourself, wear a mask, separate. There are people that desire chaos for their political benefit. That's most unfortunate. But it's unclear whether legally it'll be able to be mandated. You see employers, especially private employers, just doing it. You see UW Health mandated vaccinations yesterday. You see that the UW University has found that the state legislature wishes to mandate what they can and cannot do. My biggest fear about such an attitude is that we may find a legal climate change where measles, mumps, and rubella shots are not being given to children, because those diseases kill children. This COVID is a risk, but those other diseases are a certainty. And I'm very worried about a legal climate that, based on some concept of personal liberty, would decrease vaccinations. So don't panic. We'll get through this. Educate. We're going to be living with this virus because it's abundantly clear that we don't have the will to vaccinate everybody. And therefore, we've got to isolate, live with it, and it'll follow its own course. It's clearly not a 1 year, and it clearly, in my opinion, is a winter peak. So that's coming in October. And my hope is that the children will be vaccinated then. There are various things we're trying to do to open up, because if we're going to live with it, we got to get back, and we've got to get back to school, and we've got to get back to common sense things which are safe. There is conflicts and different information, and some people feed on that. And it continues, and it changes every day. In summary, the University of Wisconsin, of which many of us work for, has basically said, we really want to open up and get going. Come in or tell us why not. Okay. And I think you're going to see 60-40, 60% in, 40% working from home. And that may be per day. So there might be a revolving system where people will be able to separate and work. And I think if you're vaccinated, they'll be perfectly safe. UW Health has said, tell us why you should come in. And yet you all must be vaccinated. So this is going to work out. We'll have to see what happens. The key, though, to watch is the number of deaths and hospitalizations in this state and in the country. The hotspots are massively increasing the hospitalizations. They're young people. They're 20 years younger than they were last year, because we vaccinated the old people. The young people are getting sick because large numbers are being exposed to the Delta variant, and a small percentage are getting sick, but that's enough to fill the hospitals. Keep track of that. You'll be able to know exactly where things are going. I'm watching Florida. I myself just canceled a meeting I was supposed to give at the end of the month in Florida because they're willing to accept ill people. And so I'll do those talks online. UW is trying to make sure they vaccinate everybody. It may be difficult with legislative oversight. We'll have to see. We don't know what the long-term consequences of the infections are, because obviously we're going to have them. I've just written a grant to try to figure out the brain effects, which I think is the ones I'm most concerned about. Pulmonary effects as well in the people that were hospitalized. So the final part of the puzzle is booster shots. It's not clear yet. Clearly, if a variant gets out of control or is not taken care of by the shot you already have, we can make a new shot to the variant, but it takes 6 months. So the first question, because we have it on hand, is should people get boosters? And nobody really knows. Israel is beginning to say, let's give people boosters. Not the United States as yet, but it will probably come as we watch just titers of the antibodies fall over the course of a year or so. Approximately a year after your first shot and second shot, you may get a third. It's not clear, but don't be surprised. If indeed, and that has not happened, the variant defeats the present vaccine, we'll make a new one. But it takes time. So look after yourself. Do use common sense. Do things outdoors as much as you can. Mask indoors. Protect your children. And be sure to do an adaptive isolation, which basically keeps you from spread. But it's not good to not see your families and not see your relatives. Get them vaccinated. If you're indoor, mask. If you're outdoor, have a picnic, and I believe it'll go just fine. So that's what we have. We're watching the schools, but I believe they're going to open. There's a great will to do that. And I believe if they mask, it's going to work. But we probably need to spread the classes out more than we used to. Same with the office. That's where we're going. So take care of yourselves. We're going to be all right, but we have to be sensible.